ever pondered upon the intricate dance between cholinergic agonists and antagonists, how they interact within our bodies, influencing a multitude of physiological processes? Well, buckle up, because today we're diving deep to unravel these fascinating pharmacological agents. In the vast realm of pharmacology, cholinergic agonists and antagonists play pivotal roles. They are the yin and yang of our body's cholinergic system, working in concert to maintain a delicate balance. Cholinergic agonists, sometimes referred to as parasympathomimetics, mimic the neurotransmitter acetylcholine. They bind to cholinergic receptors, triggering a series of responses that mirror those of acetylcholine. This includes everything from slowing heart rate to stimulating muscle contractions to increasing salivary gland secretion. Notable examples encompass pilocarpine, which is commonly used to treat dry mouth and glaucoma, and bethanacol, often employed to address urinary retention. On the other hand, cholinergic antagonists, also known as anticholinergics or parasympatholytics, block the action of acetylcholine. They attach themselves to cholinergic receptors, but instead of stimulating them, they prevent acetylcholine from binding. This results in the inhibition of parasympathetic nerve impulses, leading to effects such as increased heart rate, decreased salivation, and relaxation of smooth muscles. Scopolamine and atropine are prime examples, used to treat motion sickness and to dilate pupils, respectively. Even though cholinergic agonists and antagonists are polar opposites in terms of their action, their common ground lies in the fact that they both interact with the same receptors. They are like two sides of the same coin, each influencing our bodies in their unique ways. To summarize, cholinergic agonists mimic the action of acetylcholine, leading to a stimulation of parasympathetic nerve impulses. This results in effects such as decreased heart rate and increased salivation. Examples include pilocarpine and bethanacol. Contrarily, cholinergic antagonists block the action of acetylcholine, leading to inhibition of parasympathetic nerve impulses. This causes effects like increased heart rate and decreased salivation. Scopolamine and atropine serve as examples. Understanding the roles and impacts of these pharmacological agents provides a fundamental insight into the workings of our body's cholinergic system. It also highlights the incredible complexity and precision of pharmacological interactions. So next time you encounter cholinergic agonists or antagonists, remember, they're more than just complex names on a prescription. They're the unseen heroes maintaining the balance in our bodies, and as we've learned today, that's no small feat. Stay curious, keep learning, and until next time, keep those neurotransmitters firing.